The next speaker is also a dear friend. He is the Dr. Arash Zarrinpour. That was one of the creators of the aligner brand that is representing Smilers and Smilers experts that made by the brand Biotech Dental. And since we were speaking about the made in France a little bit before, I also have to say that this brand is wonderful because everything is fully made in France into a new factory, and they even have the label OFG, which means Origine France Guarantee, which is certified by the state that everything is made in France from A to Z. So the lecture of the Dr. Zarrinpour will be about Smiler Aligners and Froggymouth Association, in art form and bite corrections on adults. Dr. Arash will join us on stage very soon. Thank you very much, Dr. Arash, to participate with us to the Froggydays. It is your turn.
To all of you, thank you, Guillaume, for this wonderful introduction. I'm so happy to be amongst you today for this wonderful day, which is all about Froggydays. We're all privileged people to have access to such a wonderful tool. You have to know that I have been using Froggy for quite a few years now, and in the pediatric area. So I've been talking with a Froggy team, and he said to me, don't you use this for adults? And I've never thought about using this for adults. And the fact that I started this, of course, today I don't have the time. This is not the appropriate location, and with the functionality, speech reduction from small childhood onwards up to adult age. There are some treatments. We have a problem of stability and contortion, and these are nightmares of the orthodontists. And nowadays with Froggy, it's really hard to have them into re-education or have post-orthodontic treatments. So in certain specific lateral areas, or if we have leoline problems, where we have the tongue which has an labeling incompetence, so we started to associate paradiddle smilers and with Froggy Mouse 3 to 6 months for the treatment. And there, I have to say, it was really great. And we even created a great partnership between Froggy and Smiler. So here I would like to show you how we work. What's the protocol that we use to be able to launch such treatments? So here, for example, if we limit ourselves to alveolary balance, then we're not going to talk about skeleton problems. We're going to stay here with which is really great, and here it's very adapted to this type of treatment, and it's the contortion which is behind it. So in general, we have 3 different situations that associate themselves there, 3 elements that we notice in this type of treatment. With this type of treatment, we've got an arch problem, which have a transversal issue, and especially with the premolary. And we've got a decreation and postal tooth ingression. With the protocol that we put into place today, there is a logic to bring a good arc of form in the superior area, and there we have anterior retraction, and then we have the anterior regression and the posterior regression. So here we can associate Froggy to this type of treatment. And so with this patient, we see what we can treat, where we've got this superior arcade, which is not correct, and we're going to make a resetting of the arcade, which is very efficient. So the first part is to enlarge the intercanine distance, and then to give place to the tongue again. The problem is if we don't have enough space to reposition the tongue adequately, then the re-education and the work doesn't work appropriately. And so here we want to start again with an enlarging, an intercanine enlarging, and here we're going to have an anterior digression and a posterior degression. Right, so here what you can observe is the result afterwards, and you can see with the animation what's happening, so it works really well. We've got great results in the appearance, quite nearly invisible, but of course with the whole thing. So you can see the next form of the arcade, which is a lot more beautiful, a lot more harmonized, and with a nice curve. So we've got a place for the tongue here. So for this treatment, we don't have this tool, which is Froggy, that we didn't use before. And so with all these treatments, when we had contortion problems, we always had to keep braced from 3 to 5 years. That's the time it takes that the tongue and the vertebra can be put back into place. And here I had to treat more than 3,000 cases with aligners, and every time that a patient does not want to have a brace anymore, they want to have anterior fixation, and there we've always got an issue. As you can see here, it's such a beautiful aesthetic result. I mean, it changes their smile totally. It's aesthetically very beautiful with the whole function that goes with it. Problem, however, is here. Even here, if we have a beautiful arcade as we have here, this is a patient who had these contortions on, and then we put them a smiler fix in the with a nice area. So it's a really nice contortion, and you see the contortion, and this is 3 months after we placed it. Look what happened. And this is behind the canine. Even if we glue it on the incisive canine, the tongue actually has the strength of moving it, and this forces them to replace this trough. However, we do some very important treatments, and we can have great results. Then we have an anterior digression here to be able to close this. So the protocol, you can see the Nemocast window 3D that of the smilers, and we're going to see very clearly how we're just going to close the anterior to put in the future implant to hide aesthetically the absence of the tooth that has been extracted, and lower the jaw in this case without having to modify the posterior teeth nor the arcade to close the space. Same here, we want to close this this tongue, and habits will come back, and it's going to be very hard to maintain this, although the result at the beginning is absolutely brilliant, and after a year and a half you see to which point you can really re-establish the balance, the anterior balance, to give him back a beautiful smile with a nice closing, but without, I have to say, contortions, and with a lot of work, it's not going. Without a lot of work, it's not going to stay. So we tell our patients that when we have such an appearance, we have to contain and maintain this for a lifetime. Or then we have a pure extraction that can be treated very nicely. So a case here. Superior maxillary case, and there we have the smiler story, simulation 3D of the treatment plan, and you can see the inclination, the original inclination of the anterior teeth, whether we can treat this with a smiler. We have to see the sequent thing with a nice anchoring. And then the patient, the mouth, and the beautiful results that we can have from it. And then we can retract the entire block that we had previously. And then here, where you can see we have a nice option with smilers, where we've got the smiler design, which is a virtual heightening of the patient photo. We're going to superpose the models on the patient's face. This is called a mapping, and fusions both parts. And so what we have on the virtual and the STL model is going to replicate in the mouth. We're going to see the results in the mouth, and we have a more of a dynamic picture. So with the patients, you can see on the right hand side, this is what it's going to look like, and we're going to have a closure of this diasteme and a retraction that's going to give us an idea of what the final result is going to look like. It's quite simple to do, and it's also to give for more services to have a better visualization of the aesthetic image of the patient. Then here we've got the aligner treatment, retracting and to recover the dental axis and the upper maxillary, with the result, which is quite interesting, on the arcade group. There we go. Very nice. And this is a fight again that we have with this reaction that we put into place. The tongue is not going to be happy, and we're going to have issues ad vitam, which we need to put into place to avoid that it goes back. So in all these cases, we had this fear. We had to put in the Froggy during the treatment. We associate this with a new option, which is quite interesting, that we have with smilers. Look at this case with this beautiful option here, where it's closed, and we are been capable for a few years to make a superposition of the pulping with a scanner of the model and the photo, and we have a specific possibility of having segmentation of the roots, the real roots of the patient, and to include them into the orthodontic treatment. So you can see here the pulping, and with the which is quite interesting when we have the aligners, the implant, and the closing implants. We're going to see this, and when we do the treatment, we're going to be interested in the axis and the radical axis before we can make the correct regression in the previous teeth. You can see you've got an intelligent sequencing before we have the degression that we see on the screen. Okay, so here we see it on the profile, the recovering the form of the arcade, and then the axis, and as a third part, we've got the regression with vertical axis, which is going to be far more efficient and better controlled. So here we see the mock-up. The smile is designed with the possibility to modify the lips and the label support that you can see when this closes, and the lip has also changed the autonomy of what it's going to be, and according to the relations with the teeth, to have a better option too. So I'm going to show you here the window of the ImmoCast. You can here see the model on its profile, and it's interesting to see with the root segmentation. For example, if you look at this canine, this lateral, then you have the axis, if we have the radicular axis, and how we have a regression here at the beginning of the treatment, we have the surprise that it's not going to work because the whole root is going to disturb. And then we've got the vertical axis, which doesn't correspond to the axis that is not vertical. This type of arc, this superior arc, which does not correspond either. So first of all, in the treatment plan and the timeline that you see here, we're going to have a first part of treatment, which is going to be the recovery of the nice superior axis. Right. So here you can see that we went forward. We've got the green line, which shows the timeline. We moved forward, and now we are at the step 24. So you can see for every tooth, for the timeline, we can split every movement type, which is quite incredible. It's the only software that can do this, and we replace the regressions here, so all types of movements, tipping, rotation, etc., can be programmed with speed. And the moment where this takes place, it's very practical because we can do some sequencing to really have some high areas, and this is what makes the difference of treatment in smilers. So there we have the arcade form, which has changed. We can see the axis, which is more vertical, and the interest of having a segmentation, a radicular segmentation, is to correct the staticulary in real, or not just imagining it, to correct also the arcade form, which corresponds better and is better aligned. And then we're going for the last part, go to the bottom part, and I started placing the froggy here because that's where I noticed it's the moment we've got about 10 mouth fits, which is ideal. And in general, we associate this 4 or 5 months before in this type of treatment. The froggy mouth has the type that goes down or self-aligned with the anterior regression, and then we have posterior regression to put the froggy in the mouth. So here we see the picture of the beginning of the treatment, the case 24. It's already flattened itself well, so we're ready to go down. We install some the way of going down. At that point, we're going to put it to froggy. So you see it works really well with adults. This is a tool that is really well adapted to adults because first of all it's something subconscious, so they don't need to do anything in particular. And then to have an additional constraint and to place it well is already a constraint, but knowing that everybody spends a minimum of 30 minutes in front of a PC or a series, it's very simple just to include the froggy mouth on a daily basis and to place 15 minutes per day in front of a TV series, and to keep your back really straight and correct your posture in front of the TV or in front of the PC. So this is very easy to put into place, and the consumption of Froggy Tyler works really well, and you can see this really well. Nothing is disturbing. So very good. So in general, in our treatments today, for this type of treatment, we're going to have a protocol that's going to be the same. I think Patrice Sergent has spoken to you about this morning, and we're first of all going to create a very nice arch, beautiful arch, and then we're going to have the radicular arch. And in the last part, we will have the anterior regression or the posterior ingression. And we're going to treat, we've treated tens and tens of patients with the regression. And now we're going to include the froggy mouth into the treatment at home at the moment where we're going to start this degression, so that it helps to maintain treatments a lot more easier. And nothing will stop us from wearing the froggy mouth. So we've got the nocturnal contusion, and we've got this very beautifully. Another reason why we use the froggy mouth is also here on these issues, because I treat a lot of occlusion problems. So with smilers, we have an incredible system with a virtual articulator of Nimocast, so as to reposition the mandibular to find the correct vertical position and to be able to correct the posture with the patient. So once again, in 5 minutes, I won't be able to make a whole speech around this, but this is, just quickly why we use froggy mouth with this patient. As you can very clearly see, observe the lingual pulsion, the molecule behind its canines, and the use that is linked to this posture. and you have a bit of exclusion issues when the tongue is quite low. We've got this mandibular closure, and we've got the mole and the premolary, and if we use this and look at the occlusal area, we've got the find the right reposition the vertical position. Yes, and once we've opened the vertical position, given it back a good dimension, we're going to open this, and then for aesthetical reasons, the history, and for an occlusion and a functional idea to give it back the ideal height. So how do we decide upon a perfect vertical situation? So we look at here, and we have a head scan where we have the pictures and the segmentation of the root, and we're going to be able to make a compression calculation where we can take out this compression, replace it, and we've got all the neuromuscular work to do. We can associate this to an orthodontic treatment to close the gaps, inferior and the lower and the upper gaps. Thanks to an overlay, we can design this on the same software. And we've got all the options which are necessary on the same platform. There we go. Here we see the superposition on this person with a head scan. Here you need a complete scan because we need the head, the facial skin to make an archival area, and there we can recover these items within the scanner and include them into our treatment, in our orthodontic treatment. And then we're going to see here how we can calculate the compression on the articulation and all the places that are red and contact. And we've got an extraordinary area. That's why they have pain here in the function. And to find a good vertical dimension, we can associate this in the mandible, so that everything that is orange just disappears and the compression disappears with a mandibular compression, and opens up a space which is a vertical dimension, which is then recorded during the whole treatment. And we keep this in mind, whether it's in orthodoncy, to place the overlays, and then we're going to have a snap-on, place 2 overlays and a Froggymouth to re-educate it on the muscular level. So first of all, when we have this blocked on the software, we can move on the same positioning on the treatment or orthodontic treatment plan. So here we're going to have a treatment, orthodontic treatment plan, which is going to be a very simple treatment because the maxillary is quite good on the form, and as you can see here, the inferior teeth are retracted and close this gap, and once they are in this position, then they're nearly an inverse occlusion, and we can go back to the mandibular incisives, interior, incisive and maxillary, and then we are able to add the overlay, which are designed on the same software, and these overlay can then either be placed in the beginning of the treatment or orthodontic treatment, and add the trows, which are adapted to the treatment, and with the different orthodontic treatment, which is brilliant, more effective than anything else. And so the patient will always have good positioning of their teeth in their mandibule, or maybe if the patient has a bit of not so much pain, we can do the orthodontic treatment, and at the end, like with the collage, we can put some overlay, indirect overlay, which is a snap-on, which will permit to place the patient in their new dimension and leave the patient 3-4 months in such a way before the muscular eradication starts, and we can be sure that this will be put into place. And so there is a neuromuscular reeducation made by the patient, and they also have a lingual posture, which is being, it shows very great results. So you will see on the next slide how we're going to place this up, this mock-up. Because the mock-up that you can see here, what is a mock-up? A mock-up is the model that you have seen with the overlays that are going to be printed here at the top. And this model is that we have a trough above it, and the trough is going to be filled with composite with overlay, and then we're going to place this in red. It's going to be very simple. That means in 10 minutes, 15 minutes, we're going to put an ultra precise explanation. Yes, very beautifully aesthetic, where we're going to regulate the occlusion on the patient to program it in 3D on a neuromuscular level. And during these 3 months where this patient is going to keep these composites, to live with these composites, then they're going to keep the Froggymouth a quarter of an hour per day, which is going to be very simple for the patient to associate it, which is also a relieving for the cervicals. You can see you can reposition it and put the label positioning again, which is a relief for the anatomy and the anatomy for the good positioning. So you're going to see the patient with her Froggymouth in her mouth. And here you see the last part of Froggymouth, the overlay with a new vertical dimension, and with her Froggymouth, and she's agglutinating, and see how efficient it is. So same time she's going to keep the blockade from top to bottom, and contortion top to bottom, and then the same with Froggymouth at 15 minutes per day to be able to have a very nice result in neuromuscular result. So see, we have great
As
options.
you can see, we have a very good result for Froggymouth while used in adults, and that helps in stabilizing the stabilization of the treatment. That was already very good with the smilers and all the option of stigmatization and overlaying that are unique in the world. And I invite you to try the Froggymouth and share your point of views, and that will be great. I would like to thank once again all the Froggymouth family for the support and for the. I hope that everyone will enjoy this Congress, and that we will be one day able to meet in person. Thank you once again, and wish you all the best. Thank you. I've been hiding since the beginning here, and thank you for this great presentation. It was quite interesting, and mainly to showing us in detail all the possibilities offered by the software and the aligners of the smilers, and that is the opportunity to speak a little bit later about a partnership that is existing from now on between smilers directly and Froggymouth. But before that, question pragmatically on the clinical practice: at which moment and how do you look at the patient in order to say, if there is a problem, I must use a Froggymouth in order to solve this problem of function? Very good question. I have a habit, because first of all, on the outset, I'm in charge of the orthodontics before going. I was in charge of function before orthodontics and this background. But we are dealing with a lot of children. It's a great, it's a pediatric process, because we see all the kind of issues and problems, and we've seen the open bite. There is also dysfunction of swallowing, of breathing, and so on. So it's becoming now automatic. As soon as we have that kind of problems, that means transversal of the upper arcade, lingual pulsion. We use the Froggymouth from the outset, and we choose between the duration of the treatment and the sequencing. We try to do it smartly between 3 and 6 months before the end of the treatment, and we keep doing it 6 months after the treatment. We have all the technical team of smilers who can help you and advise you on where to put and when to put the Froggymouth, and they have been trained by Dr. Froggymouth in this area. Last question. I follow your conferences. There's one point which is very important, or which is highlighted, and the audience want to hear. It is a common point between the aligners and Froggymouth, which are opposed due to their duration and so on. They have common points, which is the fact that they're mobile equipment that's a movable equipment, which is not efficient, whatever the general efficiency of the appliance. I know that you work with your assistant in order to improve this point. Can you please, in 2 minutes before closing this audience about this session, of course, we don't have a lot with the Froggy. First of all, because the patient who have important open bites are affected genetically. So the most of us to have a quality communication, to educate them, to explain why they need this equipment, this device, how it works, give them a guide. There are some guides that are quite simple. Even the book of your father, Patrick, it is indeed quite accessible to everyone to understand how the tongue works and why they need to have a Froggymouth. And since it is 15 minutes per day, and it is doesn't require a specific effort, because most of the time they're all in front of their computer or watching TV. Most of the people, they can put 15 minutes in front of a screen, and let's include that. There's not a lot of I don't have any patient who do not have a Froggymouth or do not. So I have more patients with the aligners. Because you need to have them certain time during the day. So that's why we have to coach the patient, and we set in place various protocols, feedback, self-consultation, to have communication with the patient that are quite interesting. But the only thing that is the most important is the follow-up. We have to follow the people and not to give them 15 aligners and say, oh, use them yourself, because it will be a failure. So most of the cabinet or the officers that have used aligners and they have a lot of failures, we understand it. You know why? Because it doesn't work. It's most of the time due to organization, and the offices are not organized for that. They provide a lot of information. They don't coach the patient. A patient is when the patient go back to childhood, because if they are not followed, if they are not motivated, they need a permanent motivation. So to bring often to the office to follow them, motivate them, and that works very well. We are informed for that. We have an assistant who is motivating, following the patient on a daily basis in order not to lead them by themselves or let them alone, and not to have a loss and to have a recess. And that's why we have the important role of a dental assistant. And we have in the afternoon Vanessa Shaw, the former assistant of Professor Ferrus, and she will speak to us about the role of the assistants, who have a paramount role in the Froggymouth, because it is their side of the work to provide all the information and to make the follow-up, individual follow-up, and because when the patient does not have enough time. Thank you for your presence. We will keep on working together on upcoming project very quickly with great pleasure. So meeting in few seconds, we will have a short video regarding the use of the Froggymouth and the side before the next conference of Professor Pietro Pavone.